Hello and hi, my name is Nur Fatin Raimi binti Muhammad Fazil with metric number 2022463352 from RAS 120-3G. Now, I will talk about the introduction of GERD. GERD stands for gastroesophageal reflux disease. It is a digestive disorder. It occurs when gastric acid from our stomach repeatedly flows backward into the esophagus because esophagus is not functioning properly. The Cleveland Clinic medical professional said it is called acid reflux. Acid reflux might happen after eating a spicy meal, a large meal, or when we lie down too soon after dinner. The esophagus is a muscular tube linking the mouth to the stomach. According to Gastrointestinal Society, in normal digestion, a ring of muscle at the bottom of the esophagus called the lower esophageal sphincter or known as LES normally keeps the top of our stomach closed. It relaxes and opens when we are swallowing. This allows our stomach contents to flow back up to the esophagus. Almost everyone has experienced an occasional of acid reflux, but chronic acid reflux, or known as GERD, might need treatment. GERD could wind up the permanent esophageal damage and even have an increased risk for cancer if we do not get the proper treatment. As Mayo Clinic stated that most people are able to manage the discomfort of GERD with lifestyle changes and medications.
Hi, I'm Nundina Alisha binti Gerd. I will talk about the signs and symptoms of Gerd. So, I will discuss about the symptoms. First, we have chest pain. Individuals may experience a burning sensation or discomfort in the chest. People often mistaken for a heart issue. Then we have heartburn. Heartburn is another prevalent symptom characterized by a burning sensation in the chest or throat. It may seem same as the chest pain, but it usually occurs after meals. Then we have regurgitation. Regurgitation involves the involuntary return of stomach contents into the throat. This can lead to a sour or bitter taste in the mouth. Then we have trouble swallowing. Some may encounter difficulty swallowing, known as dysphagia. This occurs when the esophagus becomes irritated and narrowed due to repeated exposure to stomach acid. Lastly, we have coughing and wheezing. Chronic coughing and wheezing can result from the backflow of stomach acid into the lungs, causing irritation and triggering respiratory symptoms.
Assalamualaikum. I'm Nurizatul Husna binti Khairul Anwar from RAS 120-3G, and I will explain about the factor of Gerd. First factor is hiatal hernia. Hiatal hernia is a condition in which the upper part of a person's stomach has moved up to their chest. Their stomach then pushed against the lower opening of their esophagus, allowing stomach acid to travel upward. Next is obesity. Obesity or overweight can also increase a person's risk of developing Gerd by putting more pressure on a person's abdomen and making a person's lower esophagus open more often when they are not swallowing. Besides that, intense exercise such as weightlifting or carrying heavy objects are also the factor of Gerd. But a person is also at risk of developing Gerd if they exercise less than once a month.
Other causes of Gerd is smoking. Smoking can reduce our lower esophagus sphincter tone. The lower esophagus sphincter is the protective closure that can prevent hydrochloric acid from going up into the esophagus. And it also acts as a valve that normally keeps foods and stomach acid in the stomach. Okay, as we already know how important the lower esophagus sphincter is, now how the smoking can weaken the lower esophagus sphincter. Smoking can relaxing the lower esophagus sphincter because the nicotine inside the cigarettes tends to relax smooth muscle inside our body. And when the lower esophagus sphincter pressure is reduced, the acid can move easily creep up and cause heartburn. Alcohol also can be the causes of this rising illness. This is because alcohol acts as an irritant and increases hydrochloric acid that are secreted from the stomach lining. Alcohol also may damage the cells in the esophagus, causing inflammation and reducing the abilities to eliminate bacteria from our bodies by slowing the digestive process and limiting the body of essential vitamins and minerals.
We can minimize the risk of GERD by changing our lifestyle. First, maintain a healthy weight. Obesity is the most common cause of GERD. This is because extra stomach fat puts strain on your abdomen, forcing gastric fluids up into your esophagus. Next, don't lie down after a meal. You have to wait at least 3 hours before lying down or going to bed. Acid reflux is generally prevented by gravity. When you consume a meal and then stretch out for a nap, gravity is removed from the equation. As a result, acid presses against the legs and flows into the esophagus more easily. You also need to avoid drink or food that can cause off-trigger reflux. For example, like fatty food, spicy food, caffeine, and alcohol. Especially for alcohol that can trigger your spasms in the esophageal muscles. Next, stop smoking. Nicotine can relax the legs muscles and interfere the saliva's capacity to remove acid from the esophagus. Lastly, avoid tight-fitting clothing. Don't wearing tight garments or belts that can constrain your stomach.